How much your skin, bones, and muscle grow during your peak periods of growth isn't something most people think about. In my opinion, it's kind of a weird thought, creepy thought, but the truth is they do have to stretch to account for 10 inches of height in just 5 to 6 years, depending on who you are. This rate of growth has been studied for decades, and the most recent studies I've gathered show just how severe this growth can be. This severity can range from not only too much growth, like I've mentioned, so like severe growth spurts leading to growth conditions and things like catch up growth, which I'll explain more about later, but also not enough growth, so things like growth deficiencies or growth disorders. So, even actually things like environmental stunting, so even things as simple as your environment could stunt your growth. So, to get started, what is too much growth, or what does that look like? So, to look for signs is you should just look for signs in common things like growing pains or growth spurts. So, what to look for is swelling in the back of your legs, maybe, or limited mobility. Things like this could indicate inflammation or swelling. That's definitely something you'd want to seek a medical provider for. Other things, or other more severe possibilities, consist of things like leg length discrepancies, so a leg growing longer than the other, needing possibly a prosthetic or a specialized shoe. That's something medical intervention could improve or help. A more rare disease is something called Osgood-Schlatter disease, which is a disease in which tendons struggle to adjust to new bone lengths. It typically causes just pain and swelling beneath your knee, just bad pain and swelling. But I'd say the more severe side of it is something called slipped capitofemoral epiphysis. I know it's a long name, but it's a hip condition in which the ball of your hip joint slides off your thigh bone. So it's definitely something that requires immediate medical intervention. It's a rare disorder. So this was all gathered in a research done by Conway Medical Center. And another study done by Magdalena Durdamazny in 2022 shows something called catch-up growth that I mentioned earlier, which is essentially when you're born small for your age. When during that period of puberty, you have an increased risk of a rapid growth, so growing above average, and you have an increased risk of obesity, things like that. So basically, you have an increased risk of rapid gain in height and weight. This is more common in females, while it is still possible in males, but typically it's associated with people who are females who are born small for their gestational age, considering they have a growth hormone deficiency, and women don't receive growth hormone the same way men do. So when I said growth hormone disorders on this, when I was speaking about catch-up growth, that refers to an endocrine disorder, which is typically identified early in like childhood, identified just by short stature that you can notice, typically in just looking at them around other children. So, but if you go more into that, it's an actual endocrine disorder. That can actually cause not only just physical limitations like short stature, but actually neurodevelopmental issues as well, such as a learning deficit or poor attention span in children, or even just decreased cognitive function throughout your life, even as an adult. But actually, if you identify this growth hormone disorder or deficiency early on in life, preferably as early as possible within the first month of birth, you can use a synthetic growth hormone to either improve or negate the effects of growth hormone deficiency. So you can negate or improve the effects of not only the short stature, but improve your cognitive skills throughout life. Not only is this recommended early on in life, so within the first 30 days of your life, but actually it's recommended to couple it with this catch-up growth I recommended earlier, as it will provide the best effects as compared to people who did not use it early on in life and with catch-up growth, or did not use it at all with their growth hormone disorder. So that was all gathered in a study done by Stefano Staggi. And again, I would like to transition into a study done by Ashraf Solomon in 2021, in which he did a study on how growth can not only be stunted by just just like a lack of growth hormone genetically, but actually a variety of environmental factors as well. So in this research, he found that poor nutritional intake early in life, as early as just the first 2 years of your life, would be the most dangerous, can receive similar effects that a typical growth hormone disorder would. Furthermore, a study done by Bree Reed in 2017 showed that even environmental factors such as the place you live in can show similar results as a growth hormone disorder, like neurodevelopmental issues. What I mean by that is institutionalization with youth can provide something researchers call just post-institutionalized youth, which essentially means when children are say stuck in an institution such as a hospital or a foster home that has a lack of environmental factors, such as care that maybe two parents would give you, or something like a room you could decorate. A hospital has pretty blank walls. That could actually lead to physical and emotional delays in maturity throughout life, the same way a growth hormone disorder could. So this deprivation in environmental factors can lead to a variety of things the exact same way. So now that you know the possibilities of simply growing on your body physically and mentally, and the various ways to prevent the symptoms, I think I did a great job at telling you today the extreme possibilities of growth abnormalities. Thank you.
Clap, clap. Hell yeah.